Thank you very, very much, Zoe, for joining us today on your Saturday off.
That's all right.
We all know that having a diagnosis of Marfan syndrome in the family can affect all family members, brothers, sisters, parents, grandparents. The Marfan Trust literature can help inform the family about the condition, but psychological problems can arise from time to time, which need an expert counselor. Dr. Zoe Berger is a consultant clinical psychologist for long-term conditions in the Psychological Services Unit at Great Ormond Street Hospital for Sick Children. Although at present the service delay in getting help is a large problem due to COVID backlog, she still recommends referral by the GP for psychological assessment or referral through the child's hospital. In this way, the various therapeutic approaches she will discuss can be personalized. Right, Dr. Berger, can you teach us, please?
Thank you, Anne, for that introduction. Like you say, I'm a consultant clinical psychologist. I work at Great Ormond Street Hospital, and I lead a team. There's about 17 of us that are qualified psychologists covering a really broad range of medical specialties, but it includes our cardiorespiratory, cancer services, palliative care and intensive care units. And I suppose just a little bit about me, I qualified in 2006, and both during my training, but absolutely since, I've worked in the field of health psychology, both with adults and obviously more recently within a pediatric context. And I guess my interest and my passion is thinking with people about how they cope and adjust to their physical health condition. So you've got me for about 20 minutes, 30 minutes, and then some time for questions. And in that time, I'm really going to very briefly touch on what we know from the literature, the health psychology literature. I'm going to consider some of the issues that you will be very familiar with and the impact that can have on psychological well-being, really as a backdrop for helping us to explore what we mean by coping and resilience. And I'm going to touch on some of the ideas around acceptance, which is kind of part and parcel of some of the strategies that we use to help young people. And then I'm going to think with you about what individuals and people in our systems can do to kind of help support us enhance our psychological well-being. So I hope that's what you're looking for. So what do we know from the literature? Well, what we know is that the vast majority of people with a chronic health condition cope and adjust well. But we would expect, certainly in the paediatric literature, so certainly in terms of thinking about children, that we would expect about 20% of children to experience some form of psychological difficulty. But the nature of those are going to differ depending on the condition and what the young person has to face on a day-to-day basis. But I think there's some really interesting, consistent findings in the research, and that really helps me, I think, in terms of our clinical work and how we support young people and their families. But we know that there's really, really consistent findings in the research that show there's no link between how severe a physical health condition is, or how severe a visible difference is, and the person's psychological outcome. And there's lots of theories and ideas about why that might be, but we think it's connected to how predictable somebody finds their experience. So if an experience is very predictable, people can develop very robust ways of coping with it. But if there's lots of unpredictability and uncertainty, it's much harder to cope with. The other consistent finding in the research is that there's really strong correlations or strong relationships between a parent's mental health and the mental health of their child. So it's really important for us to be thinking about the kind of whole family system. And we know that children don't develop in isolation. We also know that people don't live in isolation. So kind of family factors that might be about family stress, parenting style, acceptance and adjustment can all predict the outcome. And so the attitudes or the expectations, the degree of support that are shown to people by parents or other members of their family is likely to influence the perception of their own health condition. So there's variations in the types of issues that people will face depending on their age and their developmental stage. And I'm going to talk a little bit in a minute about the importance of adolescence as a time of life. And like we see many young people in the service that I work in at the moment that have inherited conditions. And as you will know, that means that there are maybe multiple people within the family that have the same health condition with either worse or similar symptoms to that person. And as a result of that, you're kind of having to navigate and juggle the multiple health needs of the people in the family. So if this was a kind of, if we had more time, I'd probably go for a slightly more interactive session and hear much more from you about the kind of issues that resonate with you. But I wanted to really pull out the themes that come up from the conversations that we have with young people in our team. And the main one, I guess, that is striking is the sense of feeling different from their peers. And adolescence is a really tricky time of life. There's multiple kind of complex tasks really that need to be navigated during that period of time. So this sense of personal identification, the need to separate from or individuate from our family, kind of live up to cultural norms, at a time where there's increased academic pressure and an increased importance on peer relationships. So it's not surprising that perhaps adolescence is a more vulnerable period of time in someone's life to develop psychological difficulties. And certainly the young people that we talk to come to us with concerns about their body image, how they look or feel in their bodies, how comfortable they are being around their friends. And that can lead to feelings of low mood and anxiety and feelings of low self-esteem. And to some extent, that's connected to some reduced ability to engage in certain activities, like kind of not being able to do contact sports or engage in PE in the way that they might want to. And as a culmination of that, there's this altered sense of identity, I guess. So an identity that feels very centered around their health condition. And I'm going to talk again a bit more later on about how it's so important to build a sense of oneself away from and separate to a health condition in order to kind of have a sense of being able to be robust and to cope with the world. The other kind of issues that people talk with us about are worries about the future, and I guess that's about jobs, that's around relationships, particularly intimate relationships, and this sense of having to live with uncertainty, both in terms of their future, their health, their life expectancy. And on a sort of perhaps on a kind of more immediate basis, we talk with young people about the challenges around for them in terms of adherence to medication, having to have or experience multiple surgeries and hospitalizations, so periods of time where they're separate from their family or their peers. And then again, loss and grief, and I think in terms of very real sense of experiencing loss within their family network, but also the kind of more existential feelings of loss and grief that life wasn't exactly how they wanted it to be, and it's feeling like a tough road ahead. I wanted to say something about visible differences, and again, I'm really aware that I'm focusing or I'm bringing to you the literature that's around in children, but I really do think it's kind of relevant across the age range, or across the lifespan, I should say. But 3.5 million children in the UK self-identify as having a visible difference, and the awareness of difference changes over time. So children, if you've got children who are young, you'll notice that around the kind of age of 5, between the ages of 5 and 7, children are developing a much greater awareness of themselves as different from their peers. So they're much more able to kind of identify differences in gender or ethnicity. And of course, that kind of just continues as we grow up and we become more cognitively able to navigate our understanding of ourselves and the world. And like I've said before, it's not really the nature or the extent of the visible difference that relates to a person's ability to cope with it. So some children are going to be teased, some people are going to be teased, but not everybody's going to be bothered by it. But just to kind of contextualize it, I thought I just wanted to put this stat in a recent survey. 46% of children who were surveyed experienced a form of bullying, and I think that's really important. And not all of those people had a visible difference. So it really is something that's incredibly prevalent, and I guess something that we need to really address at a kind of societal level, really. So let me think with you a bit about coping and resilience, and coping, resilience and acceptance, I suppose, would be the three things that I wanted to think a lot with you about. So coping is a psychological or cognitive process that's carried out in response to a stressor. And coping strategies are grouped into these kind of problem-focused approaches. And that's really the efforts that we go to solve or mitigate the problem that we're faced with. And emotion-focused approaches, which is much more about how we manage or modify the feelings that show up in response to that stressor. But using both of these problem-focused and emotion-focused approaches lead to a person's ability to deal with something difficult happening in their life. And some strategies we know to be much more effective than others. So avoidance, for example, or concealment is associated consistently with being a less good outcome compared to somebody who's much more approach-focused in their way of tackling difficulties. And appraisals is a kind of an idea or a term that's very, very linked to coping. So this idea, appraisals are like the lens, I guess, through which we interpret an event. So if we see something as very threatening to us, we're much more likely to avoid it, to retreat for a sense of survival, than if we see something as a challenge, where we're much more likely to approach it, to kind of consider it, to think about how we might be able to overcome something. And that kind of leads us on to think about resilience. And it's a really kind of, I don't know, it's a sexy term at the moment. It's a very kind of, a term in our kind of, in our common culture a lot that's being kind of passed around. And there isn't really one unified definition of what resilience is. But certainly people used to think that you kind of either inherently possessed it, so you were kind of naturally a very resilient person, or and so it's almost like it was a personality trait. But I'm kind of very pleased to say that now that's really not what's considered the case when it comes to resilience, that there's much more understanding that this is something that kind of it develops over time and is also kind of something that we can grow and enhance very intentionally in order to help us face various different challenges in our life. So we're all going to experience different challenges and traumas in our life, irrespective of whether or not we have a health condition. But it's really this sense of how we adapt to it, to be able to undergo really kind of sometimes very profound personal change to be able to thrive and survive. So being resilient doesn't mean that you're kind of you're optimistic, or that you're going to just bounce back, or that you don't experience difficulties in your life. Far from it. In fact, it's about being able to recognize what the trauma or the challenge is, and really kind of pay attention to it, explore it, understand it, and kind of undergo this sense of change, personal change and growth that allows us to be able to thrive. So what can we do to help improve well-being and help us face the challenges that we kind of have in front of us in our lives? And I'm a bit of a stickler for a diagram. I quite like triangles. It kind of helps me conceptualize what I'm doing. And really because it comes from this idea that we need a bedrock, we need a really solid foundation from which we can then be a bit clearer about the stuff that we need to talk about or think about more specifically. So I think there's something really important about knowing what the universal strategies are that we can all do to help us look after ourselves day in, day out. And some of them we can do for ourselves, and some of them we might need to do for the people around us. And really holding in mind this idea that, you know, we don't exist in isolation, that perhaps we need to think kind of about the people that we're connected to as much as ourselves. And then there might be these more targeted efforts that we use, that we identify, that means that we might need to tackle specific problems as they show up. And then, of course, there's the times where we might need to really seek specialist help. Oh, sorry. So what about that universal level? What do we mean by the kind of day-to-day strategies that we can use to improve our well-being and our psychological well-being? And it seems maybe really simple, or maybe too simplistic to state it, but I feel like it's important to that good self-care is absolutely the bedrock of that, and our physical and our emotional well-being go very much hand in hand. So very intentionally engaging in healthy eating, positive sleeping, kind of doing things that mean that we are engaged in moving our body and doing as much as we can in terms of kind of regularly exercising and moving, however gently that may need to be, but kind of engaging in aspects of good self-care. And we also know that doing one thing, however small that might be, one thing that gives us a sense of enjoyment or pleasure each day, and one thing that gives us a sense of achievement, mastery each day, can be hugely beneficial to our mental health. And for everybody, that will be different. So for me, kind of having a sense of enjoyment will be about having a moment of connection with my children, and the sense of achievement actually for me comes from washing up and making sure that I've cleaned the dishes away at the end of the night, at the end of the evening. So it will be different for everyone, but that sense of engaging in one activity that gives us a sense of pleasure, and one that gives us a sense of mastery each day, however small that might be. And building in relaxation and downtime. So I kind of use the analogy of an empty petrol tank, which is maybe fairly apt at the moment in the middle of a petrol crisis. But if we think about running on empty, when you know that you've got to do a fairly long journey, or you're likely to have a steep hill, it's pretty anxiety provoking. It's much harder to kind of be able to tackle that hill feeling like you've got enough in your tank. But if you've got a full tank of petrol, actually your long journey or your mountainous road is going to feel a lot less daunting. And for some people, building in relaxation means engaging in mindfulness activities. For the people, it's something much more about kind of physical relaxation in terms of having a regular massage, or maybe running a deep warm bath. I don't know what it would be, but just ensuring that that doesn't get lost in the busyness of life. And certainly thinking about how we stay connected to our strengths in the face of sometimes a sense of lower self-esteem. So being very connected to our resources, our strengths, the people around us who help us to feel very connected to that, so that we all are connected to others, and we'll know the people that give us a sense of purpose and meaning in our life, will give us make us feel good, will help us to be very attuned to who we are as people, rather than seeing us just as our health condition, which can sometimes become very dominant. I wanted to say a little bit about specifically what parents can do for young children or people in their family when their physical health condition is very much at the forefront. And so for me, talking openly and honestly about what's going on in a young person's life can be absolutely the bedrock of their mental health, listening without judgment when a young person talks about their experiences. And that might be about their physical health condition, but it might also be about what's happening at school or in relation to other areas of their life. So being curious about people's experiences, and even if you're not a parent of a child, knowing about doing that for the people around us can be hugely beneficial. Normalising this idea of difference, and I know that schools have got really excellent campaigns now that think about addressing difference and certainly tackling bullying, but there's lots of books and films that can be really great from introducing this idea that there's not a cultural norm, or there's ways of challenging cultural norms really from a very young age. And as a person, as a parent, or as a person with a person in your family with a health condition, staying very calm and confident when responding to curiosity that others may have about the condition. So really modelling this relaxed and open manner, so that can be something that your child can take confidence from, but that there's a sense of solidarity in helping people to navigate some of the more tricky stuff that might come up when they're faced with difficult social situations. And I'm going to say more again about kind of building this identity separate from your condition. If we're thinking about more targeted interventions, I think part of the skill in life is knowing when to ask for help, and that might be asking for help from your friends, your families, from professionals in your network. And there's lots of evidence to suggest that peer group support can be hugely beneficial to people, and that's certainly in terms of reducing isolation, gaining a sense of validation for people's very difficult experiences. There's a wealth of self-help material out there for very specific problems, be that anxiety or low mood or low self-esteem or social anxiety. And so knowing how and where to access that is always really helpful, and is a much more targeted intervention. And then for children, tackling procedural anxiety. So that's one of the things that we see quite a lot of for children who've got multiple surgeries or hospital admissions, and really having a robust approach to helping them to manage any feelings of anxiety that show up can be part of a very targeted intervention to help them manage what's going on for them. And getting school involved so that school and teachers understand what's going on, they can explain to other children, but also that they can look out for teasing and bullying that might be problematic. And maybe if it's not school and you're in a different stage of your life, it might be about thinking about the relationships and conversations that you have at work, to help them also understand what might be going on for you. And then, of course, at the top of the triangle is seeking more professional, more specialist help if it's needed. I've got a couple of slides I wanted to share on thinking about questions, but also on staring. So I'm going to start with questions first. Really this idea that most people ask questions because they're curious, and holding that framework in your mind. But having a really flexible approaches can be really helpful. So, and you'll know for yourself, if you go to the local corner shop and the person behind the counter says, "How are you doing?" you probably respond by saying, "Yeah, I'm fine," compared to when a close family member or friend calls up and says, "How are you doing?" and you say, "Actually, you know what, I had a pretty ropey week and I'm feeling a bit rough." You will all have different responses to different people in different contexts in our life, and having a repertoire of ways of responding to questions about visible difference can be really helpful, because it allows you to feel prepared and in control of the situation. And there might be a whole wide range of those. You might have some very factual responses that you use to really quite humorous ones. And I was talking with a young person just the other day about some scarring as a result of surgery. And he had a very factual response, which he told some of his friends, which is about his condition and why he needed to have surgery, right through to a kind of slightly more humorous and a bit dismissive response, which was that he'd had a run-in with a shark. He also had he had an incident with a low-flying helicopter. So he has a kind of repertoire of responses, and it allows him to feel like he's got the skills to be able to respond should a question come out of the blue. It's quite useful to kind of think of the response to a question with these three kind of parts to it in mind. So having a bit of explanation, having a bit of reassurance, and then offering some distraction. So for example, a young person might say, on the back of a question about their visible difference, they might say something like, I was born with a condition called Marfan's. It doesn't stop me from playing Lego, which is the reassurance piece. Shall we play together, which is the distraction bit. The other thing that I think is really important is if we're anticipating questions or staring or a sense of feeling, we carry with us this sense of feeling different, then it's very easy to avoid being in social situations. And certainly some of the adolescents we talk to really struggle with entering into social situations or starting conversations, but being proactive in starting a conversation can be hugely helpful. And there are three key ways that you can start a conversation. So you can offer a compliment, you can ask a question, or you can share information about yourself that then springboards into a conversation. And again, having a kind of pre-planned sense of how you might be able to go confidently into a situation can be really helpful. So for example, a compliment might be something like, I like your pencil case, or if you're an adult, you might say, oh, I really like your coat. You might ask a question of where do you live, or where did you get that coat from? And then you might share some information like, I went to the football yesterday, do you support a team? And what about staring? I guess staring is another thing that lots of young people that I speak to have to deal with. And yes, it's again really important to remember that most people stare because they're curious. They're trying to make sense of what they're seeing. They're not deliberately being hurtful, but I recognize that still feels really hard. And one of the most effective ways of dealing with staring is to look back, to smile at the person who's staring, and to hold their gaze for a few moments. But there's also useful to have, again, some other strategies up your sleeve, and that might be about moving away. It might be asking them to stop. Or for other young people in situations that we talk with them about, they might use distraction techniques to kind of help them to stay in the moment, cope in the moment with the difficult feelings. And so distraction might be about really just kind of thinking about your favorite place or a safe place. And we do some safe place exercises with people, counting backwards until that person no longer stares or that the moment has passed, or doing something that's a bit more mindful, which is about being very present in the moment. So thinking about one thing that you can hear, or you can see, you can touch, you can smell, or you can taste. And irrespective of what situation we're in, those kinds of strategies can be really helpful for all of us to kind of ground us in what's going on in the here and now. So one of the key things that feels important in coping with and being resilient towards our health conditions and the challenges and the adversity that we face in our life is this sense of being able to grow your life outside of your health condition. So if you look at these two circles that I'm sharing with you, they're both, if we imagine that they both represent everything that your health condition is to you. So the day-to-day struggles that might involve, the feelings that you have about having a condition, the kind of living with the uncertainty of the future, the stuff that feels tough or is time consuming or is burdensome. When it takes kind of forefront of our life, when it takes up the largest proportion of our life, it can feel incredibly heavy and burdensome to carry around, and like there's very little space for anything else, and can be what dominates in the way that we view the world and how we interact with others and how we behave, how we feel. And the skill is absolutely to think about ways of growing life around it. So though the burden feels the size of those circles exactly the same, but engaging in things that help us to put it into shift the relationship we have with it, shift the proportion of of our time and energy that it takes up can be hugely beneficial to us. So the bits that might go into growing life around your health condition might be things like your hobbies, your relationships, your friends, your families, your connections with people, your passion, your jobs, the things that help us see ourselves for ourselves outside of just what it is that we have to deal with on a day-to-day basis. And another kind of analogy I use, and I think is quite helpful, is to think about imagining yourself holding this clipboard right in front of your face. And the clipboard is a bit like those circles on my screen. The clipboard is the kind of health condition that we're having to navigate and deal with in life. And it can feel, it's all consuming. It's the only thing that you can see if you're holding it right up above your face. But also your arms are aching because it's tiring to hold it up. And it's quite isolating because you can't see the people around you very easily because it's right there in front of your face. And yeah, it can feel isolating and burdensome and tiring and exhausting. And that's very different from if we place that clipboard on our chests, or even better still, we place it in our laps, and it feels different. You can see around you, you can make eye contact with the people around you, you can have a rest, your arms ache less because you're not having to hold it up so much. The size of the clipboard is exactly the same. The challenges we face with regards to our health condition are exactly the same, but our relationship with it has changed. It's no longer there in front of our face, but it's resting on our chest or it's on our laps. And of course, there might be times where it kind of creeps itself back up and it's right in front of our face again. But the skill is about how do we have a changed or shifted relationship with our health condition that allows us to lead a life that feels like very connected to our values and our and the things that are important to us. And that leads me on to this last bit that I want to share with you, which is about acceptance. And there's acceptance is accepting what you can't change and committed to valued action. And there's lots of talk about cognitive behavior therapy in the world of psychology as a treatment of choice. And of course, it can be incredibly useful and helpful. And there's lots of evidence to suggest it's very effective with certain mental health difficulties. But actually, and it's sort of the kind of premise of cognitive behavior therapy is about thought challenging and setting yourself behavioral challenges, really, to experiments to kind of manage a feared or a difficult situation. But it's really very much harder when you're faced with a physical health problem and or a visible difference, because actually some of the thoughts that people have, or most of the thoughts that I speak to about, most of the people that I speak to and who share their thoughts with me, they're very valid thoughts. It's not really about challenging something that's a very valid thought, but more about increasing or moving towards this idea that we can have a changed relationship with some of the thoughts that show up. And it's important to kind of talk a bit about the difference between values and goals. And so if we think about goals, a good example of a goal is deciding that you want to get married. So the goal is getting married, and that's it's a fairly binary outcome, that you either manage to get married or you don't. And you can either feel like you've fulfilled your goal in life or you're striving constantly to that goal. A value of being loving and demonstrating loving or feeling loved is one that you can do in every aspect of your life. It doesn't matter. It might move you towards your goal of getting married, but you can enact being loving in different forms and guises and relationships throughout your life. And anybody who's got children, I've got 2 small children, and long car journeys absolutely drive me mad. And so I'm hoping that people in the audience can relate to me when I share it. But going on holiday, for example, having the two of them in the back, kind of the constant questions of, are we nearly there yet? How much further have we got to go? And if you have the goal of getting to your holiday destination and you're very goal driven, you're going to be focused on how long you've got to go and how much longer you've got to take until you get there. But if you've got a much more values orientated child, you're likely to experience them being connected to their values of curiosity and adventure and playfulness. So you're going to experience that child looking out the window and noticing the cow, or counting the number of red cars that go past on the motorway, or wanting to play I Spy. So if the worst case scenario happens and your car breaks down and you never make it to your holiday destination, both are going to be disappointed, but one is going to have had an experience of having enjoyed the journey. So the kind of premise around acceptance is this idea that if we can be clear about what our values are and live in accordance with them, we can lead or a much more sense of fulfilled and thriving life. But of course, that means that we have to cope with the difficult feelings that show up for us in the moment. And I was talking with another young person the other day who was really keen to live alongside her values of being somebody who is gregarious and fun and wants to have relationships. So it's really kind of connected to wanting to have friendships and relationships, but is very anxious about going out in social situations, and so tends to get into the habit of spending a very long time getting ready, using lots of makeup, and not accepting very many social invitations, and avoiding difficult feelings that come up, the worry about what it would be to be in a situation where she might be asked questions, or that people might be staring at her. So, you know, the short term is really helpful. She doesn't have to experience the levels of anxiety because she keeps herself to herself. She doesn't go out to these social events, but she's not leading a life that's connected to her values. And so the piece of work that we're doing is about how she stays very connected to those values. She accepts the invitation, but she has to cope with the difficult feelings that show up in the moment. And some of the ideas around mindfulness, many people in this audience will have tried that, I'm sure, but really helping us to stay grounded and to recognize that there's a distance between the thoughts that we have and how we can act on them.
We all got the idea. It's fantastic. Zoe, you're the very doctor we've been looking for all these years, and we're going to have to go back and revise our psychological pamphlet completely. But I would like very much, we've had questions coming in throughout your talk, and I'd like to hand over to Victoria because she's got a list of them. Perhaps we can carry on as long as we can until, say, another 7 minutes till 12:25. How about that, Victoria?
Yes, let's do so. The chat feed is filling with questions, so I'll cut to the chase. A parent of a young child has written, the young child feels very isolated amongst their 4 unaffected siblings. But they also live in a perpetual state of heightened fear. They feel everything very acutely. They feel they're going to die every time a football hits them in the chest, and the parents at their wits' end as to how to mollify them.
How to
mollify them, just what to say.
Yeah. So the kind of the anxiety about, so there's two parts to that then, isn't there? There's the bit about feeling different from other siblings, and potentially a sense of not being able to do the same as their other siblings. And the other bit, which is about a perpetual fear of, I guess, injury or harm coming to them as a result of being engaged in different activities. Is that right?
Yes, it's almost a sort of constant perpetual state of panic that's never relieved.
Yeah.
The parent describes it.
Yeah, absolutely. So, I mean, I would say, I don't know how old this child is, but I would say that there's, you know, the being in a place where there is opportunity. So I suppose it speaks to this, a number of things I'm thinking of, the opportunity to talk about what those worries and fears are. And it will, of course, depend on the age of the child as to how able they are to do that. There are some really nice books, you know, storybooks about worry, about how it feels to be different, but also how it feels to feel worried and how overwhelming those worries can be. And so I would certainly be recommending to parents that you open up conversations about those worries, that you're giving space. By doing that, you're giving an implicit message that it's okay to talk about those things and those feelings. And you're also able to work out which of those worries are solvable by certain kind of shifts or changes in how somebody might approach the difficulty or the problem, versus how much is about recognizing and acknowledging that that's part and parcel of what this young person has to live with. And then I suppose that's where the kind of values piece comes in, which is about, well, being able to play football or engage in activities with their siblings is probably going to be high up there on what they want to be able to do. So it's about thinking with them about how they manage that, even at times where they're feeling very anxious. So I don't know how old the child is, but I can say if I go back to my presentation, I can share I don't know how I can do that easily, sorry. I can share some resources.
Sorry to interrupt. I think the child is approximately 10, quite young.
Yeah, I mean, so some of these books are going to feel, I was going to share some books that I think are pretty good for young people. They're actually probably better for children slightly younger than 10, but there's you know, I guess no harm in thinking about looking at some of them and seeing, yeah, my sense would be they're too young. Can I get to them and then I can share my screen again? Sorry, that's...
Yes.
So I'll go down here. The other thing that is often quite useful is doing some journaling with young people. So there's some really nice books. Can you see that? Can you see that? Different is Awesome. Yeah. That Different is Awesome. Awesome is written by a young person who's got visible difference. The Perfectly Norman and Ruby's Worry and Ravi's Raw are for younger children, as is Elma. But Uniquely Me, Different is Awesome, and We're All Wonders are all books that are written about kids that have differences from people around them and that have a whole range of feelings in association with that. So it may well be very useful to kind of use that as a springboard into conversations with children about how they're feeling. That's a very long answer.
Thank you. No, that's perfect. That's thoughtful. Thank you. And someone else has written to say their 14-year-old son has Marfan syndrome, but with significant cognitive disability. Yeah. His level of understanding of Marfan syndrome is limited. Are there any strategies you can recommend in circumstances of cognitive disability?
Mm-hmm. Sure. Yeah, absolutely. So we often use what we call social stories, or individualized stories for young people who have a range of cognitive difficulties and also neurodevelopmental difficulties like autism, and they're stories that use images and very simple text to help make sense of or understand their physical health condition and also how they might be feeling about it. So I would imagine this young person is under a paediatric centre, and I would be asking for some support in putting together a social story to help them understand about their condition in a way that's appropriate to their level of cognitive ability.
Thank you. Another question has emerged. Linda's son is 10, nearly 11, has recently had growth hormone injections to limit his height. Mm-hmm. So it has kickstarted puberty and he's quite affected by it. Mm-hmm. He's inherited Marfan from his father, who died from endocarditis 6 years ago. How can Linda help him? How can she find counselling for him?
Mm-hmm. So if the counselling's around the loss of his dad, then there are some really nice charities which she may or may not be aware of, I don't know. Winston's Wish is a fantastic national organisation that helps children who've lost a parent in a variety of different circumstances. So Winston's Wish I would recommend. Grief Encounters is another really useful charity for children who've experienced bereavement. And then so I would go for those two to start with, and they both have online resources, and pre-COVID times they would run groups and workshops and residential weeks and weekends and stuff for families, but during COVID times lots of that's gone to remote. I might have some links to that as well. Let me see. Sorry, these are other kind of, I might share this. This is really good. So this is urgent support and help that's available. Couth is a really good website. Calm Harm is another app if young people are experiencing feelings of self-harm. Obviously there's the Samaritans, which offer a helpline. I can share all of these resources so people can have access to them outside of this, outside of my talk. But I haven't got those. Yeah, bereavement, I just put that down there. Cruise, Grief Encounters and Winston's Wish would be the ones that I would signpost people to for bereavement. Does that help? There's also that Young Minds and Changing Faces, and Dove has done some really fantastic campaigns around like animations, really nice animations for young people and adolescents that is kind of really accessible around how to deal with stuff that makes us feel different, and therefore the feelings that show up as a result of that.
Thank you.
I think probably, Victoria, that's all we've got time for, but we will attempt to answer any other questions afterward with Zoe. So thank you very, very much from all of us. That was marvelous.